At the Academy this year, I talked a little bit about antibiotic resistance and brought up a topic that I hope was new to the audience, and that is the topic of mutant selection window. We've been talking for a long time about the dangers of antibiotic resistance, but we haven't looked at it in this way, which is a topic that was first discussed by microbiologists, and I don't think dermatologists have quite caught up with it. The idea is that the mutant selection window is a dose curve, it's a bell-shaped curve, in which the development of mutations is most likely to occur. Down at the very lowest end of the dosing spectrum, below the MIC for the organism, we have no development of resistant organisms. And above what's now called the mutant protection concentration, which is a very high dose, there's no development of resistant organisms either. But in the middle, you have a population that started off being primarily sensitive. You killed off all the sensitive organisms. Now the resistant organisms have started to populate the patient or populate the petri dish, and what you have now is the rampant development of resistant organisms. For every antibiotic and bacterium combo, there is a different mutant selection window. And of course, for some of the antibiotics, you can't go above the mutant protection concentration because it's a lethal dose. But the overall idea here is if you can go above the mutant protection concentration, you ought to, because at that point you've killed off all the sensitive organisms, you've gotten rid of the infection, and you have not allowed the development of resistant organisms. So how does this apply to us? In my way of thinking, it means in acne land that perhaps our use of 50 milligrams, 75 milligrams of doxycycline or minocycline is not a very good idea. Maybe if we're treating our acne patients, we ought to be treating them with 200 milligrams, the highest dose that we can, so that we're killing off not only the sensitive, but also the first generation, the first mutation resistant organisms. It also means that if we could find a topical antibiotic that would flood the epidermis with very high concentrations, which is poorly absorbed so that it does not end up in the systemic circulation, you would have in excess of the mutant protection concentration on the skin and well below the MIC in the body. And that would be an alternative way to treat our patients with acne with topical antibiotics in a safe way that does not promote the development of antibiotic resistance.